bipolar versus borderline personality disorder. In this discussion, we will differentiate between bipolar disorder and borderline personality disorder, since depression is a component of bipolar disorder. Personality disorders, such as borderline personality disorder, differ significantly from psychiatric illnesses like depression, anxiety, schizophrenia, and bipolar disorder, which are transient states of being. In other words, one's personality is one's inherent nature, while illnesses are temporary conditions. Using the analogy of climate and weather, we can compare one's personality to the climate of a region, while a disorder like depression is the weather that is currently occurring. Borderline personality disorder is a complex topic, but we will briefly define it using the Diagnostic and Statistical Manual of Mental Disorders, 5th edition. Borderline personality disorder is marked by a pattern of unstable relationships, self-image, and emotional expression, characterized by impulsivity, and beginning in early adulthood, as evidenced by 5 or more of the following criteria: frantic efforts to avoid real or perceived abandonment, a pattern of unstable and intense interpersonal relationships characterized by idealization and devaluation, markedly persistent or unstable self-image or sense of self, impulsivity in at least 2 areas that are potentially self-damaging, recurrent suicidal behavior, gestures, or threats, or self-mutilating behavior. Unstable, reactive mood, such as episodic low mood, irritability, or anxiety that typically lasts for a few hours or days. Chronic feelings of emptiness. Inappropriate, intense anger or difficulty controlling anger. Transient stress-related paranoid ideation or severe dissociative symptoms. It is important to note that the diagnosis of borderline personality disorder is based on the presence of multiple symptoms rather than a single characteristic, and it should manifest as a problem in various aspects of one's life, not just one relationship. Therefore, it is inappropriate to diagnose someone as having borderline personality disorder based on a single symptom. Dissociation happens when a person disconnects with their present situation, and this disconnect can vary from feeling like you're in a dream to feeling like you're observing yourself from outside of your body. Now, I want to circle back to the difference between bipolar disorder and borderline personality disorder. While both disorders can involve episodes of depression, bipolar disorder also involves periods of manic or hypomanic episodes, which are not present in borderline personality disorder. Mania is a distinct period of elevated or irritable mood that lasts for at least 1 week and is accompanied by symptoms such as decreased need for sleep, racing thoughts, increased energy, and impulsive behavior. Hypomania is a milder form of mania that lasts for at least 4 days and is less severe than mania. In contrast, people with borderline personality disorder experience unstable moods, but these moods typically last for hours or days, rather than weeks as in bipolar disorder. In conclusion, while there are some similarities between bipolar disorder and borderline personality disorder, such as episodes of depression, there are also important differences. Bipolar disorder involves periods of mania or hypomania, which are not present in borderline personality disorder, and the mood disturbances in borderline personality disorder typically last for hours or days rather than weeks. Understanding these differences can help individuals receive a more accurate diagnosis and appropriate treatment.